Well, this is Eric Michael Lloyd, Master's in Psychology, Neuropsychology concentration. I also wanted to address other concerns that brought to my attention about the use, um, particularly in the older population, geriatric population, older than 65, regarding psychotic symptoms with methylphenidate, that's Ritalin. This article was written by Elie Gadjan, Gadran. Um, I'm probably not pronouncing that correctly. Marianne Musavi and Palade, Padede Gaeli. So, Gadran, Gad, Gadra, Dan, Gadra Dan, Musavi, and Gaeli. The title of this article, written by those researchers and authors, Methylphenidate-induced psychotic symptoms in 65-year-old female with ADHD. Abstract. Methylphenidate, a stimulant, is prescribed commonly in the treatment of attention deficit hyperactivity disorder, ADHD, in children and adults. Methylphenidate is generally considered a safe medication. However, some rare adverse effects, such as psychotic symptoms, may occur with its therapeutic or high doses. Additionally, this medication has a potential of abuse, especially among teenagers. There are several published cases regarding methylphenidate-induced psychosis in young adults. However, psychosis due to methylphenidate has been rarely reported in the elderly. This case presents psychotic manifestations due to methylphenidate in a 65-year-old female who was taking this medication for ADHD. She consumed 3 to 4 methylphenidate hydrochloride tablets per day for several months and thought they were sleeping pills. So, yeah, that would be basically, you know, taking a medication that she thought was something else and taking probably more than necessary, more than recommended, even. Antipsychotic medication was initiated and methylphenidate was discontinued, which resulted in improvement of her psychosis. Alternative diagnoses, including bipolar mood disorder with psychotic feature or mood disorder due to general medication condition, were ruled out because her psychotic symptoms appeared after taking several methylphenidate tablets and disappeared after discontinuation of this medication. Keywords: attention deficit hyperactivity disorder, methylphenidate, and psychosis. Methylphenidate is a central nervous system stimulant and is commonly prescribed for the treatment of attention deficit hyperactivity disorder in children and adults. Also, it is available in both immediate release and extended release formulations, which are different in half-life and duration of action. Methylphenidate is generally considered a safe and tolerable medication, although its side effects, including insomnia, headache, anorexia, gastrointestinal complications, are common. So those are things to look out for: insomnia, headache, anorexia, gastrointestinal complications, stomach problems, digestion, the intestines are common, okay? Although it's considered safe and tolerable. This medication has a potential of abuse, especially among teenagers. The abuse potential of methylphenidate exists due to the euphoric feeling after consuming high doses of this drug, oral, intranasal, like a spray, or intravenous injection, basically in the veins. Using high doses of methylphenidate has been reported to cause serious complications, such as psychosis, seizure, liver damage, and cardiovascular side effects. So those are real precautions for high doses of methylphenidate, as I would imagine with pretty much anything, right? Any drug, particularly that has potential for abuse. So psychosis, seizure, liver damage, and cardiovascular side effects are the serious complications at high doses. Previous studies have suggested that psychotic symptoms may be found following methylphenidate consumption in patients with ADHD. Most of the related causes have been reported in young patients, especially shortly after the initiation of methylphenidate consumption. In a case control study, Auger et al. Noted the occurrence of psychosis in high doses of methylphenidate, that's greater than or equal to 120 milligrams, is significantly higher than its occurrence in standard doses of this medication. So Auger and colleagues, Auger et al., found that high doses, so that's extremely high, 120 milligrams, is significantly higher. The chances of the occurrence of psychosis, the incidence of psychosis, is much higher from what Auger and colleagues studied at 120 milligrams than the occurrence of psychosis at standard doses. So that's 120 milligrams, and the difference was 14% occurrence of psychosis versus 3%. Okay. Again, this is for medical, this is for informational purposes only. I have a master's in clinical psychology, and I'm not a medical doctor with the prescription ability. This is all for informational purposes only, as everyone has the right to know about research and can ask about research, learn about research as well. And this is also highlighting what are some of the potential